sitting on my doorstep, the people's passing by. They're coming back from getting wrecked. Everybody's high. Saturday night, what a bitch, laying on the lawn. The morning comes to bring the switch after the buzz is gone.
Hello and welcome to another episode of Addictions, the podcast about addictions. I'm your host, David Wagner. Today on the show, we are speaking about withdrawal. We are going to focus on mainly the physical aspects of withdrawing from various substances, but later in the show we will be touching on the more psychological stuff. It tends to be the physical stuff that really causes people to end up using again and relapsing, at least early on in quitting. So that's what we're going to touch on first. But before we get to any of that, I want to remind all of our listeners that, as always, you can find us on Apple Podcasts, Spotify, Stitcher. I believe we are also on TuneIn, which I believe works with the Alexa home assistant thing. So yeah, you can check that out. Also at our website, you can find all of the past episodes from both Season 1 and Season 2. There's a menu bar and you can find the episodes linked there. You can also go to the website and support the show. If you really love the show and want to help us out, throw some spare change our way, whatever, you can make a one-time donation through PayPal by clicking the Support the Show link. But enough of that crap, on with the show. So, okay, as I stated earlier, we are going to be talking about physical withdrawal first. And mainly we're going to be focusing on opioids here. One thing that I want to make incredibly clear is that not all of these substances are created equally, okay? Opioids have certain physical hooks that actually chemically hook into your brain, whereas things like cocaine, speed, methamphetamine, these types of hooks are not as prevalent. So you do not necessarily have the same physical withdrawal, say, from methamphetamine that you would from opioids. With opioids, it's a lot longer drawn out process, the physical symptoms. And, you know, there are a lot of reasons for having to go through withdrawal. You know, whether it's you just have to quit cold turkey, and by cold turkey, I mean you just totally stop. And with certain substances, this can be deadly. If you simply stop drinking alcohol, you can suffer DTs and seizures, and that can be fatal. The same goes with many benzodiazepines, especially Xanax. In the recent past, I know that we've seen many deaths from that exact reason. People just cold turkey quitting Xanax and having seizures and dying, and that's just terrible. So anyway, talking about the physical withdrawal symptoms from opioids. Now, it depends a lot on what type of opioid you are on, whether it's heroin, buprenorphine, morphine, hydrocodone, oxycodone, fentanyl, whatever. It can be a little bit different for all of those different opioids, but they all share a lot of the same withdrawal symptoms. It's just the length of time for those symptoms is different because the half-life of all of those different opioids is different. For buprenorphine, I believe the half-life is around anywhere from 46 hours to 72 hours, and by half-life, I mean this is how long it takes for half of the substance to leave your body. Now, when we talk about drugs like hydrocodone or oxycodone, we are looking at a half-life of roughly 12 to 18 to maybe 24 hours. And again, that's just the time it takes for half of that substance to basically leave the receptors on your brain. Before we get any further, though, I must, and I can't stress this enough, I am not a healthcare professional, I am not a doctor, I am simply an addict who has went through this myself, okay? Now, some of the first symptoms that you're going to feel from many of the various opioids out there, whether it's heroin or hydrocodone, some of those first symptoms are going to be things like the chills or goosebumps or feeling cold when it's 80 degrees out, it seems to be that there's something to do with body temperature regulation going on there. And, the only thing that can really help with that is things like blankets and warm baths. I can't stress how important it was for me to have access to a nice warm bath while I was going through my withdrawal process. It helped out a lot, not only with the body temperature regulation, but with things like the sweating and the goosebumps and even the nausea. A nice warm bath can really help out. But you don't want to overdo it with the baths, because I actually was taking hot baths for such a long period of time that I gave myself rhabdomyolysis, which is actually kidney failure, combined with forcing myself to vomit, because that was the only way that it would really relieve my nausea, combined with hour-long hot baths, caused certain muscle proteins to break down in my body. And when my kidneys try to process those proteins, when anyone's kidneys try to do that, the kidneys shut down because those proteins are toxic to the kidneys. This can result in what's known as rhabdomyolysis. I may be pronouncing that wrong, but yeah, it's not fun. Kidney failure is not good. It can be fatal. I was very lucky to have gotten to the hospital and gotten the care I needed for that. But that being said, opioid withdrawal is rough, but you can get through it. You just have to be careful with what you do and pay attention to your body. Some really important things to take into account when going through withdrawal from opioids is that your body it's going to be hard to eat. So if you can take vitamins, that's going to help. If you can eat, that's really going to help. But one of the most important things is exercise. Even if you have to force yourself, even if it's just a 5 or 10 minute walk, and I've said this many, many times before, exercise releases endorphins in the human brain. These endorphins are very, very similar to the chemicals that opioids provide for your brain. And so they can help to alleviate a lot of the withdrawal symptoms. As far as the length of time of the physical symptoms from opioid use, I would say, depending on what you're on, buprenorphine, it's going to take a little bit longer, but after the first week or so, generally, much of the physical withdrawal aspect of opioid withdrawal is gone. And then you're left to deal with the psychological withdrawal, which for some, that can be the toughest part. That's not to say that the physical aspects of opioid withdrawal are a walk in the park, because they certainly are not. Imagine the flu times 100. I mean, you have muscle aches, just overall body aches. Your entire body hurts. For me, it was like my skeleton was trying to leap out of my body. At times during my own physical withdrawal from opioids, I had severe insomnia where I couldn't sleep, whether it was due to restless leg syndrome or just general insomnia, but I couldn't sleep. So any sort of non-addictive, non-narcotic sleep aids are going to help with getting sleep while you're going through opioid withdrawal. Sleep is very, very important, not only just during opioid withdrawal, but in life in general. Your body needs its rest. One thing that I really do want to stress about going through opioid withdrawal is that if you can taper down your dose of your drug of choice as low as possible, whether you have to give your drugs to someone you can trust who can dole them out to you on a taper schedule, or if you can do it on your own, just lower your dose over time as much as possible until you can get to the point where you feel comfortable jumping off. Not only will this minimize the physical withdrawal symptoms, but it can shorten the length of time of some of the psychological effects too. Before we move on to talk about some of those more psychological symptoms of withdrawal, I do want to touch on benzodiazepines and alcohol. Now, with benzodiazepines, I want to kind of specifically focus on Xanax. It seems to be the more widely abused benzodiazepine out there, as opposed to, say, Valium or Klonopin. When you're going through benzodiazepine withdrawal, it is very important to really taper that dose down, especially with a doctor, if at all possible. Taper that dose down as low as possible. Because if you jump off cold turkey from many benzodiazepines, you can have seizures which can be fatal, and this is not something that you want. You want to live, trust me. It could be a lot worse. Now, if you're someone who's abusing benzodiazepines without a prescription, then you may be limited in the ability to work with a doctor in an effort to taper your dosage down. If that's the case, then the responsibility kind of lies on you. You can either bite the bullet and get medical help, or you can slowly taper your dose down over time by continuing doing what you're doing. But the best bet is to quit while you're ahead and lower that dose as low as possible and then jump off. Many of the symptoms of benzodiazepine withdrawal include many of the same symptoms from opioid withdrawal. Things like insomnia especially. Many people use benzos as a sleep aid, which is really not what they were meant for. They do have off-label use for that, but that was not their prime directive when they were first developed. That being said, the main symptoms from benzodiazepine withdrawal are going to be things like the having kind of like shaky hands, tremors, seizures, diarrhea, things like this. A lot of the same symptoms that you're going to be dealing with when you're going through opioid withdrawal. Now, kind of moving on to alcohol withdrawal, this is where it gets a little tricky. Alcohol kills the most people out of any of the substances out there. It's estimated that one person dies every 10 seconds due to some sort of alcohol-related incident, whether it's overdose or a car accident. Some of the symptoms from alcohol withdrawal, they occur primarily in the central nervous system, and the severity of the withdrawal, it can vary from really mild symptoms like sleep disturbances and anxiety to severe and life-threatening symptoms such as delirium and hallucinations, and these things are not good. Withdrawal from alcohol typically begins around 6 to 24 hours after the last drink, and it can last for up to a week. To be classified technically as a patient with an alcohol withdrawal syndrome, you must exhibit at least 2 of the following symptoms, which would be increased hand tremors, insomnia, nausea or vomiting, transient hallucinations, whether those are auditory or visual or tactile, anxiety, tonic-clonic seizure, or autonomic instability. Now, autonomic instability is a condition where the nervous system does not work properly, and this might affect like the functioning of the heart, the bladder, the intestines, sweat glands, pupils, blood vessels. It comes with its entire own range of symptoms. The severity of these symptoms is often dictated by a very large number of factors, and the most important of those are which degree of the alcohol intake, the length of time the person has been using alcohol, and previous history of alcohol withdrawal. A lot of the symptoms are grouped together and they're classified. You can have alcohol hallucinosis, which is where patients have transient visual or auditory or tactile hallucinations, but otherwise they are clear. You can have withdrawal seizures. These seizures would occur within 48 hours of stopping alcohol use, either as a single generalized tonic-clonic seizure or as a brief episode of multiple seizures. And the third category is delirium tremens. These are states of disorientation, tremors, impaired attention and consciousness, and visual and auditory hallucinations. This usually occurs 24 to 72 hours after stopping alcohol. The delirium tremens is the most severe form of withdrawal, and it occurs in around 5 to 20% of patients experiencing detox and in around 1/3 of patients experiencing withdrawal seizures. Alcohol withdrawal, a lot of people do go through it on their own, and a lot of people die from it, but there are treatments out there for alcohol withdrawal, and if you are someone who is suffering from alcoholism and dealing with this, this is something that you need to go to the doctor to deal with. Only a doctor can prescribe the medications that can help you get through alcohol withdrawal. Baclofen is one of the first-line medications used in alcoholism. It can help stop the cravings. It can help stop a lot of the symptoms from withdrawal. and it's just generally a good thing. But unfortunately, you need a doctor to prescribe that for you. Now, moving on to some of the more psychological symptoms of withdrawal from basically all substances. And let it be noted that here we're talking about pretty much all of the more nefarious substances out there. We're talking about speed, cocaine, methamphetamine, benzodiazepines, alcohol, opioids. Even caffeine can have some psychological withdrawals, believe it or not. But to better understand what psychological withdrawal is, let's look at a little bit of an example. Many drugs superficially increase the production of dopamine. It's a neurotransmitter that is responsible for feelings of reward and pleasure. And once someone stops using a substance that affects dopamine levels, the brain has to relearn how to produce that dopamine naturally. And this can take a lot of time. It can take months, it can take years, and the individual may experience psychological withdrawal. For many, overcoming this psychological withdrawal can be the most difficult challenge in recovery. Unlike the physical withdrawal symptoms, which typically last a few days to a week to 2 weeks, psychological withdrawal symptoms may linger for anywhere from 6 months to a year or more. And despite the potentially long-lasting symptoms of psychological withdrawal, it's important to know that the severity of these symptoms dramatically diminishes over time. And this is especially true for those who receive proper aftercare treatment. And by proper aftercare treatment, I'm talking about counseling, therapy, talk therapy. These types of things will really help. Like for myself, by doing the podcast about addictions, this is incredibly therapeutic for me. This is my counseling. But moving on, let's talk about some of the symptoms of psychological withdrawal. These are things that include depression, anxiety, agitation, emotional overreactions or numbness to emotions, sleeping problems like insomnia, higher sensitivity to stress, lack of motivation, mood swings. For many, it can be a mental roller coaster that's filled with ups and downs, and it can often even make you feel bipolar. But the fact is that you just have to keep a strong mind and remember that these psychological issues are there. It's not something wrong with you. It is because you have stopped taking a substance that was replacing chemicals in your brain. And now that those chemicals are no longer there, your brain has to relearn how to do this, okay? So it's going to take time. So anyone who's in the depths of psychological withdrawal from any substance, go out and find the help you need. Do it one way or another. Whether it's self-help groups, whether it's counseling one-on-one or group counseling or whatever, go out there and do it because it's only going to help you. That is going to do it for this episode of Addictions, the podcast about addictions. As always, I want to thank you all so much for listening. It really means a lot to me. And don't forget to stay updated on new episodes and all sorts of other stuff. Be sure to follow us on Facebook at facebook.com/addictionspodcast. You can also find us on Twitter. It's twitter.com/addictionscast. Our handle on Twitter is @addictionscast. Again, thank you all for listening. And remember, never quit quitting.
Then you smashed your only car. You aren't what you are really. You missed it by so damn far. Your head feels like it's in a blender, and you hate to see the dawn. Your stomach says return to sender after the buzz is gone. And Sundays you prayed Uncle John. You poisoned yourself last night. Mary slapped your friend Tom. You got in a hell of a fight. Monday comes and it's back to work. The week seems so damn long. time's past, you're still a jerk after the buzz is gone.